you're comfortable starting.
Are you talking to me?
Yes, sorry.
Oh, it's okay. It's all good. It's all good. All right. So I'm Jamin Brahmbhatt, a urologist. I think you guys saw my super glamour shotted picture up on your social media platforms. And, one thing is, I've watched some of how this has been done. And I actually do have like a 100-point PowerPoint presentation that I can run through, but that'd probably be really boring. So we're not going to do that. But we're going to try to make this as interactive as possible. One thing that really always gets pre-med students excited about my background is I used to be on an admissions committee at one of the universities that's very highly sought after here in Florida. So I do have experience in, on the back end of what, people look into, et cetera. But I also have the experience of being told my whole life, I'm not going to be able to do what I want to do because my grades weren't as good, because I didn't have the right mindset, et cetera. So a lot of losses and failures and negativity still brought me to what I want to do with my life, which is practice medicine every single day. So, hopefully we can keep this extremely, extremely interactive. But for Abigail and Michelle, like, is it more question answer, or do I just kind of bore you guys by constantly talking, or do you want me to show you some cool urology pictures? Or, I don't want to take away too much from the awesome format that you guys have, or I can just really do a show and tell for the next hour. So
Yeah, honestly, it's totally up to you. Like if you have like any pictures or a case
yeah.
to share, then that would be really great.
Yeah. So everyone that's listening here on the chat, while I kind of go over some really cool things, what is your understanding of what a urologist does or what a robotic surgeon does? So if you guys are all awake, paying attention, I see everyone has their screens off. I don't know if that's on purpose or people don't want to show their face. Why don't you put on there what you think a urologist does or should be doing? Because honestly, what the biggest issues I had is I didn't even know what urology was. So while I'm waiting for you guys to put your comments in the chat here. So I didn't even know what urology was, to be honest with you, when I went into medical school. So this is my background. I grew up in New Jersey. I went to undergraduate at Boston University, and then I actually entered Boston University Medical School after 4 years of doing undergrad. There's this program called a medic program. So I always wanted to get into these 7-year med programs, not because I wanted to do it myself, but because all the other Indian kids around me, my cousins, everyone were applying and getting into them. So I just felt pressure into doing it. I didn't get in. So then I took the other route, which is, I think, the more fun route, which is going to college for 4 years and not having any preconceived thoughts on, oh, I'm definitely going to be doing medical school, et cetera. But the second I entered BU, really, it was like solidified in my head that I definitely want to do medicine, just because of various experiences we could talk about later. But that's when I'm like, I really got to work hard and try hard. And so at BU, they have this program where your second year, you apply to medical school early. So you get accepted early. And it's very competitive. In the room, the first day, there were 400 people. You look left and right, all those people were there. And then in the end, they chose, I think, 10 people. And I was one of them, which was pretty cool. But then you get in early, and then from there you go to Boston. You still have to take the MCAT. You still have to do all the other prerequisites. You still have to finish college. But you're guaranteed a seat at one of the top medical schools in the country, which is awesome. Then, I went to BU for 4 years. And at BU, during my rotations, I thought I wanted to go into general surgery. I wanted to be a surgeon. I wanted to rip out bowels, do all these major cancer things. And then I entered my surgery rotation, and I pretty much hated it. Because the personalities just did not mesh with my personality. I don't know if you guys can tell, but I love what I do, and I'm super excited and super positive. And, people say I exude a lot of annoying energy, but, I didn't really feel that around my other rotations. And then I didn't really feel that around general surgeons or, that specialty that I was like super excited to be a part of. I mean, I committed 2 years of research to general surgery. But when I got there, it just wasn't for me. So I actually did urology as a one-off because I heard it was like a really fun week that you would easily get a pass on. So I did it more for selfish reasons, but then I ended up loving being a part of urology and wanting to really go into urology. Now, what were the other things that you're about urology that attracted me? I'm not going to tell you just yet because I want to read what you guys have written in the chat. So we have, you guys think urologists focus on the reproductive system and the male general system. I see you copied that from google.com. Awesome. I'm just kidding. I don't think you did. Genitourinary surgery relates to reproductive organs. Awesome. Does it have anything to do with the urinary tract? Yes. Urinary, reproductive, urinary, reproductive, urinary, reproductive. Yep. So you guys hit the, you guys got it right. So I didn't even know this was a specialty, to be honest with you. I was so oblivious to it. So you guys are already far ahead of me. I really just didn't focus on anything else because all I thought was I wanted to be a general surgeon. So I didn't pay attention to pediatrics, internal medicine, like radiology, anesthesia, none of that stuff, because I was just so, at that time I thought it was focus, but I was, I would say very extremely narrow-minded. So I did the rotation and this is exactly what I learned. I'm like, holy crap, there's like this amazing specialty that really is a very unique organ, very unique part of the body. And it's not just what I used to think it was. Like back in the day, urology, all I thought was about Viagra and erectile dysfunction and sexual function. It's not the case. What I realized in just that 1 week is we see we see patients from all different backgrounds. We see males, females. We see all different age groups from newborns till, they're in their last breath, because everyone has pretty much to pee. And everyone in that demographic, that age group can have issues with their kidneys, can have issues with their urine tubes, their ureters, their bladder, their prostates. Women have pretty much all the stuff I've mentioned except the prostate, and they have nerves and tissues that are equivalent to the penis and the testicles. So it really is a very dynamic part of the body that can be really exciting to treat. And the most exciting part about urology is that I don't just have to stick with medicine. I don't just have to stick with surgery. We're able to combine both in getting our patients better. And whether it's me doing a surgery to remove a big kidney stone, or whether it's me giving someone a medication to help them not wake up at night excessively, there's a lot of cool, unique things that we can do within urology. I see Vic here. He watched a YouTube video on urology a long time ago. Awesome, man. That's awesome. So you have researched this topic. So urology really piqued my interest at that moment in time, but this is where I hit another major roadblock. And that's, no one thought I could get into urology. First of all, no one thought I could get into medical school because I honestly was not the most invested in becoming a valedictorian. That's the best way I can describe it when I went to high school. So I didn't, really have the best, I was in the top 25%, but I wasn't in the top 2%. And I wasn't getting the best grades, the top grades. But I was always told that by my parents that I can do it. I was told by my friends I could do it, to my family I could do it. Everyone else thought I couldn't do it. So I actually did it by working really hard in college at BU. But the same thing with urology, like my step 1 score wasn't that great. So you guys probably know, like, when you go into medical school, like you've got to take all these exams, because unfortunately, a lot of the times it's less about what you can do and your true potential. It's more about how you can take a stupid exam. So I had like a above average score, but for urology, you need like a super above average score. So I was told, even by some of my advisors, that, hey, this is going to be a really big long shot. Like, are you sure you want to do it? And I did it. And I did my rotations and followed basically like the book for it. And I matched, I matched in urology. And when I opened the thing, even I was in disbelief, because I was like, I know I worked hard, but there's a lot of things that were against me when it came to like certain numbers on certain papers. But I matched, and it wasn't like I matched in my last program. I matched into one of my top programs. So, it was truly amazing to finally make it there. within there. And then I did residency at University of Tennessee in Memphis. So I went from living in Jersey and Boston to moving down south. And then I actually did an extra 1-year fellowship in robotic microsurgery, where we used a robot to operate on some of the smallest parts of the body. So it's been a 14-year journey that I've just described to you here in the last, few minutes. It's been a long ass journey getting here, but it's been an amazing journey. And it all started off with pretty much me entering a room that I wasn't even supposed to be in my first case as a medical student in my urology rotation, not even knowing what the specialty was, and now I do it every single day. So it's just wild how certain things just kind of come together. So let's see. I actually did. I don't think anyone wrote anything else on there. So one of the things that students always ask me, and if you guys have any questions, please put them on there. Michelle, if there's anything in the past, because please let me know. But everyone always wants, obviously you're part of this group, and everyone wants to get into medical school. And everyone wants to get into medical school, I really do feel like, for the right reasons. And so what we all get caught up in doing is pretty much doing the same thing. So while you guys are all still paying attention, the one thing I learned behind the scenes, and obviously I can't share too much detail about my time being on this committee, that really, I wasn't part of like the main admissions committee, but I was part of like the selection committee that, pretty much the kids that got the interviews. So what I realized is like a lot of people just follow like a certain book. So it's like after a while, every kid just looks the same. They've all have these certain criteria that you have to meet, and they meet it right there. 1,000 hours of this, 200 hours of this hours of this. And by the end, we had seen so many applications. I could tell just based on ethnicity or last name how their application is going to look, because, or even by their school. Like if they came from XYZ school, I would know exactly how it'd be structured. And even some of the recommendation letters would all really start sounding the same. The people signing them off would be different. So you can see, like, when we get into like, really looking at the nitty gritty of your application, like, you may not have made it based on your score on the first round, but when we start looking at that second, third, fourth round, because, pretty much we met every single week, it really does come down to you and who you are. And I will say that there were definitely kids that I'm sure would make great doctors, but their application was just so sterile that, someone that had something unique within their application definitely was ranked a lot more favorable than someone that pretty much had, the same thing and just followed like a certain book and a certain structure. And that's because a lot of schools right now are looking for unique talent. They know based on just your score and you applying and your desire to go into medicine and, spending all the time doing your applications and all that stuff, that you're going to make a good doctor. But what they want are individuals that are going to also become leaders within their field, individuals that are going to kind of help raise that university's profile, individuals that are going to do something kind of outside the box. And I think that's where it's very important for you guys, as you're on early on in your career, looking into this stuff, is like, what can I do that's unique? What can I do that's outside the box? What can I do where I'm not just following some, guidance from an individual that's sitting in, in a room somewhere, or some book, or some forum online? What is it, something different that's going to give me that edge? And I've seen it, and I can share with you some other time. You can, find me on social, and I can kind of share some of these nitty gritty details. But I hesitate to bring it up in a forum like this, is because then all 20, 30 of you guys are going to all start doing the same thing. And then again, we get into the same problem where you're doing the same thing over again. So that's why it's important I not share it here. But I think that's a very good thing for you guys to know about, is, anyone can become a doctor. It's just you have to get into that school first, that education. And yes, grades are good. It's a good start, but it really comes down to you being a unique individual. So show it. Show who you are. Don't try to hide it. some of the coolest kids that we selected, just, I don't even think they took seriously like them doing baseball in college, or them going on a trip somewhere, or, you know, them doing something unique for someone in their community. They just kind of put it in there randomly, and we're like, whoa, this is pretty cool that they did that. So really, we, you know, some people think no one looks at these applications. There are a group of individuals looking at every single application, every single word, and trying to find those tidbits. So it is important that you take that stuff seriously. So. All right, we have a question here. What do you think is the most interesting part of your practice, and what is the best memorial career advice you have ever received? So, urology. So let's talk about urology now. So, what is the, I think for me, every single day is interesting in my office. So then this is why, because all throughout the urology office, I know some of you guys are in high school, but you're going to see very unique props and tools in our office because we're a urology practice. The funniest thing about what I do is my mom has a really hard time even explaining it to people because I'm Indian. We grew up in a very conservative family. And sometimes she'll still tell people that I do kidney transplants, even though that's just something I did for a few months in when I was in residency at part of my intern year, because she has a really hard time telling people that, you know, I'm a penis and a ball and a urinary leakage and a prostate doctor. But that's what I am, man. I take it and I enjoy it. But you can see how an Indian conservative mom has a hard time explaining to people that, you know, 25% of what I do is helping guys with erections, or the other percentages has to do with the testicles and all this other things. So I think she's very proud of me, but I think it is a little bit difficult to explain. But, you know, I think the most interesting part of my practice, and I realize this now 7 years in, so I finished at the age of 31. Fortunately for me, like my parents did support a lot of my education. But in school, they don't really, that's, I would say the most interesting part is the first couple weeks of being done with all your training, is because you realize you haven't learned anything. You went to school for 14 years and you did residency and fellowship and everything, and you realize like you haven't learned anything. And I don't mean that in a bad way. It means like you still have a lot to learn, because you get taught how to operate. Any monkey can learn how to operate. You get taught the fundamentals, but when you actually start practicing, like you're like, whoa, there's no one behind me that's like my attending. This is really all me on my own. And this is pretty scary, because then you got to start thinking about billing and coding and finances and all this other things. So that is where like I had some stressful moments, and that is where I got my best advice, is where a mentor of mine told me is just trust your gut, you know, and trust your heart. So trust your gut, meaning, you know, if you get stressed out, just go and eat your slice of cheese pizza, because I know that's what I like to eat when I get stressed out. So when you're stressed and you feel that craving, just do it. You know, do whatever it takes to get you to relieve that stress. But when it says trust your heart, is you went into this with a good mindset and you went into it with a good heart. So just trust it. Just trust everything that everyone has taught you, and you'll be just fine. And so in my mind, I constantly have those words from my mentor, but then I also have this note. In college, when I didn't get into the medical school early, whatever, 7-year medical school program, it was kind of very depressing for me because everyone expected me to get in, and I didn't. And so my cousin wrote me this little note, and she wrote on there, "Do him proud." Do him proud. That's all she wrote. And I still have that note at home in my home office. What she was saying by saying do him proud is do my father proud. That's it. Just do your dad proud, or do your family proud. And so it's like always a constant reminder that if I always follow a certain value in a certain way and try to leave that same legacy my father did for, or has for me, he's still alive. He's here right now in Orlando with me. He's a fun guy. But you know, do him proud. So as long as You can trust your heart because you went into the right reasons. And then you always think about like who you're representing. And I'm representing my family. At the end of the day, you're going to be just fine. So can you tell us about interesting memorable case? All right. So about cases. All right. So I'm going to share my screen with you guys. I do have some really cool things to show you guys within urology. So now can this be like, does it have to be G-rated or?
No.
All right. So I'm not able to screen share. Can you give me access to screen sharing? So I'm going to show you this and I'm going to take you for a tour of my office to show you what a day of my life looks like here in the office.
Okay, you should be able to screen share now.
I'm good.
Yep.
I'm good. All right. So here we go. So here we go. Urology right here. So these are all my accolades right here. And et cetera, et cetera. So urology, people think we're plumbers. So my typical day for urology is I spend half my time operating and the other half I'm in the office doing clinic. So I like to split my days in half. So on Mondays and Wednesday mornings, I start with my surgery cases. And then after lunchtime, I rarely ever get a time to eat lunch because I'm always kind of running through lunch between clinic and surgery. The other half is in clinic. So a typical day in the OR, I may see cases like this, where we really truly are human plumbers. And this is us evacuating a hydrocele, which is a big fluid collection around the testicles. You can get it as a kid, which usually goes away on its own. But as an adult, you can get some inflammation around your testicle, which can then lead to a swelling around there. And so there's these big fluid sacs that form around the actual testicle. And what we have to pretty much do if it doesn't get better on its own or becomes a problem, this guy, his scrotum was so large, it was hanging down on the toilet seat. So it was even a hygiene issue for him. So this is us actually going in, finding that sac and us draining it. This is another cool thing that we do is on the left here, you're going to see a huge ass kidney stone in the actual bladder. So if you guys can see my mouse, you have these two white things on the sides. They're basically your hip joints right there. And then you have your bladder, and then it's and within that white spot is actually a stone. And within that stone, you actually see a catheter. So this patient had a catheter that was just in there for way too long. And then he started forming stones around that Foley catheter. So we actually had to go in. And this guy, a lot of stones now, because of technology and the use of a laser, we're able to kind of just zap those stones out with the laser. But you can see here, this was pretty damn big. It was pretty much taking over most of his bladder. We actually had to make an incision and dissect our way through the belly, down into the bladder, open up the bladder, and pretty much take the stuff out. What you see on the right is not the stone we took out from the bladder. That's actually a big stone that we took out from the actual kidney. And you can see how this stone actually probably started off as something small, but then grew to become, 8.5 centimeters or so, and pretty much took over all the insides of your kidney. So urologists are not the medical doctors of the kidney, so we don't do dialysis. We don't do like medical management of really bad blood pressure and all that other boring stuff. We actually are the ones that operate on the kidneys when people have cancers or stones or other blockages or other issues. So that is some of the things that I may be taking care of on a daily basis. So this is where it gets a little graphic, guys. I want you guys to guess what organs the two are in the middle here while I'm telling you about the other stuff. So go ahead and put it on the chat. So on the left side is something called a penile fracture. So because we deal with sexual function and sexual dysfunction, sometimes we have to deal with oops moments as well. And this is someone that actually had a fracture of the penis. This happened during a sexual injury. This is one of the rare things. So a lot, urologists, there are some really emergency things that we have to go in for. This is one of them. There's no real bone in the penis, but you actually have this connective tissue that when it has some pressure on it, when it's erect, it can actually open up and crack. So here, this individual not only cracked one of their corporal bodies. That's where the blood gets engorged in when you're having an erection. But he actually tore into some of his urethra as well. And the urethra is pretty much where you pee from. So no one even tried to guess what those two were on the inside on the chat group here. On the right side here, that's an uncircumcised kid who got his foreskin stuck in the zipper. And in the middle, very interesting story here. I was called in because there was a canister full of something next to this patient with an open scrotum. And we're like, what is this? So we took it out and this is what came out. And initially we didn't even know what this stuff was. I'm like, what is this? Because he had so much swelling around the scrotum that it felt like he still had testicles in there and all this other stuff, just an open area. But when we actually looked at what this stuff was, on the right, you see his testicles. So this guy had some mental disorder. He actually ripped out his testicle. Sorry if I'm getting too graphic here. On the left side was actually his eye. Obviously nothing to do with urology, but just an example of how we have teamwork here between all the specialties. So those are just some of the things that I do. And I know some of this stuff sounds a little bit on the extreme side, but we do other things here for surgery. We can take care of kidney stones. There's some really abnormal blockages that can happen of the kidney where the kidney meets the ureter, where we have to do some reconstruction. But what I actually subspecialize in, my fellowship is in infertility. So I actually do a lot of procedures that are linked with male infertility. And then we also subspecialize in chronic pain, chronic testicular pain. So if you go to myballshurt.com, it actually comes to our website. And so even within urology, we've kind of created this niche with infertility as well as testicular pain. So, we may see all these other things. So really, I don't really know what is normal for my office and what I expect to see, because it's just always different. It's just always unique what we end up seeing. But that's a great question, Vic. Thank you for asking that. So while you guys are thinking of some new things, I'm going to show you our office here. And our office is a typical doctor's office, but my typical day would not be possible without my team. So, a lot of people assume, doctor does all the work, but I probably do the least amount of work. I get to have the most fun, I would say. Most of the work is done by really this amazing team of individuals that you have in here. I don't know is everyone here, I'm sure everyone here is interested in some kind of medicine, but has anyone thought about some careers outside of just getting your typical MD or DO? So I would love to hear that in the chat group. So I'm going to change cameras, Michelle, so that I can take you for a little walk in my office here. But until then, if anyone has any questions, I can definitely. All right, can you guys see this? Michelle, quality is not as good. I'm not going to look as, bright and young and fresh, but it's all good. So, oh shit, what'd I do? Hold on. Okay, there we go. All right, so I'm gonna take you guys a tour of my office here. Oh, awesome. So we have some people interested in public health, which is awesome. Listen, let me tell you something before I take you for a tour of my office. I would say, listen, everyone can become an MD 4 years. I think that my biggest regret is not taking a year off in medical school or even before medical school and getting an advanced degree in business, because I just love the business aspect of not just medicine. I actually have a side hustle where I do e-commerce and sell stuff on Shopify and Amazon and stuff. And I wish I had taken a year off to really explore that. But public health is going to be huge. You're going to be so highly sought after, especially with what's going on with COVID and all the changes happening in the world because of disease. I think that is something you should definitely do. We have MD, PhD. Wow, that's blessings to you. That's MD PhD, I could never do that because I just don't like the research aspect of it. And I see someone here mentioned business development, medicine, advocacy, legislation. That is awesome. But Christian, let me tell you something. You're going to be so disenchanted when you start because you're going to see the behind the scenes of medicine, which is not really always super duper exciting and can be disenchanting. I would definitely keep your spirits high and don't give up on your goals over here. We have someone that wants to do nutrition. Oh, that's awesome. Nutrition is very important. I would say 25% of what I do in my clinic is nutrition. So I've actually gone on YouTube and learned a lot of stuff. My wife actually did a whole nutrition course so that she can kind of teach me all the latest and greatest trends in diets and all these other things. And I see PA, which is awesome. So I don't work directly with PAs. Actually, I do work with PAs in the office. In the OR, because we have a group of PAs that come in. But usually in my office, we actually have nurse practitioners, which I think is an awesome, awesome specialty. So I'm going to introduce you to some of them here, but keep asking your questions. I hope the internet doesn't suck here. Mary, are you working? So as the chief director of my office here, I have to make sure everyone's always working. And Mary, they wanted to know if I work with PAs. I said, no, I work with NPs.
Yes.
So Mary is on Netflix right now when she's supposed to be working. Mary, why aren't you working?
I'm doing my early training.
I know, I'm just kidding. I'm just kidding. So we have a really cool dynamic here. So Mary is our nurse practitioner. So Mary joined us when? 5 years ago? Oh, okay, 5 years ago. She was, and I've been here 7 years, and she's awesome. And NP school is very difficult. She did it, and she survived time with us, which is awesome. But I know you guys are thinking about PA, but nurse practitioner stuff is pretty awesome too. I think you make the same amount of money, have the same amount of fun.
In practice, we do the same thing.
But she's also a big Disney nut, as you can see in her office. And then from here, we're gonna meet a nurse. Do you guys know what a nurse is? A nurse is a male nurse. So this is Earl right here. So Earl is actually one of our awesome nurses. I need some light so I look good like you, bro.
Yeah.
So Earl is actually one of our awesome nurses. I'm introducing all these aspiring individuals. Some of them want to be public health people, PhDs, PAs. They're all young and excited to go into healthcare. So Earl actually never wanted to even thought about healthcare. He actually was part of Disney animation. So he was an animator. And even before that, he served in the military. So thank you for your service, sir.
Yeah.
What did you do?
I was a missile launch officer.
Okay, what does that mean?
I was ready to launch 10 nuclear missiles at Russia.
Okay. And now he puts catheters in for a living. So.
It's kind of like the same thing.
Well, thank you for your service. But you can see, you could have, you guys all already know what you want to do, but he was very confused, but now he knows he loves urology. So, all right. So next thing we're going to go and see is, who are you?
What's happening?
So this is Dr. Kalisti. She is my partner in crime. So everyone thinks urologists are all dudes, but we do have females in urology as well. It's Dr. Kalisti right here, and she's awesome.
What are you doing?
I'm part of, this is called Medical Marvels, and Michelle is the executive director.
Oh.
They're all individuals aspiring to go into medicine and healthcare. So I actually, in a month ago, had a kidney stone myself as a urologist, and she took care of my kidney stone, which I'm sure was very awkward. But she's awesome. We actually do a lot of the same things. So a lot of them ask what our day looks like. Our day looks exactly the same, but flipped. So when I'm in the OR, she's in the office. When she's in the office, I'm in the OR. And then the rest of the time, we're just, I don't know, what do you do on the weekend? Have fun? We don't want to get personal here, but this is Dr. Kalisti.
Nice seeing you.
Yeah. So now we're going to go see everyone else in the office. This is our computer If anyone wants to go into IT, this is where all the computers are here.
Might go set up.
Earl,
There you go.
okay. I'm supposed to be working right now. So this is our office. So we have a very boutique office. You probably won't see many doctors' offices like this. We have a very feng shui atmosphere. And so when you actually come to our office, this is where you would enter from. It almost looks like a hotel entry point because our whole main initiative when we design the office is we want people to feel comfortable. We want people to not get stressed out about being in a doctor's office. And so we really made it a very comforting atmosphere because a lot of the stuff we've talked about already, it's very intimate and deep. So we want to create that awesome atmosphere. So this is, what's your name? We have this thing in the office where I act like I don't remember their names, but I know your names. Beth? No. Kat. Okay, all right. Just kidding. So Kat is here dealing with patients and making appointments. And then can I get an appointment with this guy? This guy, does he have any appointments? 3 months? Okay. The actual, all jokes aside, it's about a 6-week wait to come see me right now. But then we're going to enter the behind the scenes of our office. So, you know, what most people don't see is your office staff are very important to your success because, you know, patients are going to see them more than they're going to actually see you. So from beginning to end, they have to have a really good experience. And if you don't give them a good experience, they get survey scores. And now your survey scores are actually linked to how you get paid. So it's very important to be all customer service friendly. So here we have Leo. Leo is one of our top individuals in the office. He also works out like a madman, but he's one of our chief schedulers here in the office. Chief schedulers, motivators, etc. So we really do believe in a team mentality. So these are some of the faces you're going to see. This is our team, and each and every one of them is kind of committed to making stuff happen. So going on to our office here, again, this is probably not like some of the offices you've seen. We actually don't have rooms, we have gates. And in each gate is a destination. So if we have anyone from London here, is that London? Oh, that's New York. New York here. I don't even know my cities today. We represent New York. This is always a favorite with my patients. We have Las Vegas in the house. Yeah, that's right, Vic. New York, that's right. We have Paris. So it's really cool because patients, these are the things that they remember is like, hey, I didn't really go into a room. I went to a destination. So room 4 for all my Indians here, we got India representing here. That's the Akshardham in New Delhi. And then finally, I knew we had London here somewhere. This is actually London right here. So this is kind of like our space where we see patients in clinic. And then being a surgical subspecialty, we have a procedure room, but this is the area I was told not to show you guys, but I will. This is where all of our props are for erectile dysfunction. We got penis models. And then we got implants. We actually put in penis implants in people when nothing else works. I know you guys don't want to talk about this, but that's urology. But then we have central command here, and then I'm going to show you our procedure rooms. So this is where we do office-based procedures. We do a ton of office-based procedures. And then this is our Vicky, come here, meet the kids. So this is our office procedure, and our theme here is the world, because you can go anywhere you want here. But we have some really high-end technology. This thing right here is actually my favorite. This is a cystoscope, and so this is actually what we use. Oh, I didn't know you guys were gonna see my colors on my scrubs here, so that's why I just wore 2 different colors. But this is a cystoscope. This is actually put inside the urethra, and we can actually look inside the urethra and look for any scarring, tumors, lumps, bumps. But we actually also use it to go inside the bladder and remove any foreign bodies within the bladder that we can do in an office setting. Hope this doesn't fall because stuff is very expensive. Okay. So that's just one of the procedures we do in the office. I also do a whole bunch of testosterone stuff in the office. And then this is a machine It's called a urodynamics machine, and this machine actually helps us look at the nerves and the muscles and do like a whole exercise of the actual bladder. And this is we don't do this on everyone, but they do this whole hour-long procedure with this thing, which helps us look at, okay, what is truly damaged? Is it a bladder damage? Is it a prostate issue? It doesn't always change what we do, but it just sometimes makes us feel better about the decisions we're making. And this thing right here is a Euroflow machine where a patient pretty much pees into it, so we can kind of measure their flow volume and see how we can improve it. So in any urology office, you're also going to see a lot of pictures and props. So these are some pictures that we give patients about prostates and different procedures that we can do in the office. I want to introduce you to Vicky. So if Vicky, I will never, Vicky, where's Vicky? Vicky? Hello. Hello. Vicky doesn't like being on camera. So Vicky, these are people from all across the world.
Hello there.
And
Charlene.
Charlene is also here. Oh my
Called
God.
you Chanel.
I've only been here.
She only started 2 days ago, and I forgot. You only started 2 days ago. Charlene, I will never forget your name.
You're forgetting.
Oh my gosh. Okay, so you can see we have a fun dynamic here, but what was the question?
I don't know. I don't think there was a question.
Was there no question? We're bored in this presentation. You suck. What are you guys writing this on the comments? Do you educate people on male birth control? Yeah, if you Google my name, I've done a lot of articles on it in the news. And how many hours do you work in a day? Okay, we'll answer those questions in a sec. So Vicky is a nurse and RN, right? RN?
Yes,
Are you an RN?
yes,
What does that stand for?
Registered nurse.
Really nervous?
No.
So Vicky, I'll tell you an interesting story. She's been with me for 7 years now. And then I was trying to get her fired her first month. Yeah.
He didn't give me a chance. He didn't know how good he had it.
I didn't say it. I wasn't trying to get you fired, but we didn't really, because and this is why I'm talking about team, because everyone just wants to be a doctor, a
Yeah.
PA, and then they think they're the
Yeah.
boss, etc. But the reality is, like, you need all of these people, even Charlene, whose name I forgot. But behind every doctor is like 8 people, actually 8 or 10 people, right? Because this is not my team, this is the patient's team. So I'm just one of those individuals that is there to help that male or female. And a lot of doctors sometimes forget that. They think they're like the bosses. And I mean, I am the boss in some situations, but most of the time when it comes to taking care of the patient, team approach. So without her, can you show Charlene here? What are we covering her up? You guys should have cleaned this place up. We look like a hot mess here.
We have some stuff to put away.
But it's Friday afternoon. I think some people went home. And look at this. Look, now she's lounging over here. So we have a really cool team dynamic here, and hopefully you guys are able to kind of see that during this walkthrough. So I'm about to show you a room. That's in our office. So we have tons of room space, office space. But this is a private workroom. So if you guys were paying attention, I mentioned to you guys that what we do. H wants to be an RN. Yay, Krupa, how are you? Akshardham, that's right. So this room right here is very cool room right here. And this is, I'm not going to touch anything in this room. This is our semen analysis room. So as I mentioned to you guys, we do a whole bunch of male infertility. So when we're kind of analyzing our patients, we have to kind of not only check hormones, get their whole story, but we want them to have babies. And sometimes the reason they can't have babies is because their sperm is not that great. So they have to give us samples of their semen or their ejaculate. And this is the room that they would come into. This room is probably one of the best, nicest rooms you'll see for semen analyses. A lot of places are not as nice because, again, we want to create a very comfortable environment. And then, do you guys want to see our bathroom? Want to see our bathroom? Oh, why not? Okay, this is our bathroom. Guys, I'm showing them our bathroom. Okay. So this is our bathroom right here. We have a sink, scrubs, but what's really cool is we have a shower in our office. Most doctor's offices don't have a shower. Thank God we have a shower because it really helped during COVID. But you know, I just like to have a place to shower either before I go home or after coming home from the gym, or coming from the gym straight to work, or if I just feel like it sometimes. So that's our tour. Did I forget anything, guys? I took them up front. Yeah, yeah. So let me show you my office here. So my office, because I do a little bit of this with other people, I've created like a little mini studio here to make me look fresh and young. Because in reality, I'm really old and boring. But what I really want to show you guys was, I'm gonna turn the lights on here so you guys can see, is first of all the hard work gets you nice little plaques on the walls here. This is the biggest degree, which is my BU degree, and then you have everything else from residency and my board certification. But this is what I love the most. Never give up. And these are all the medals that I've gotten running different races. So I used to be a very chubby kid from New Jersey that used to love his gulab jambus and Indian food and all that stuff. And I love to eat. And health was never a priority. But then when I became a urologist and then started to get out there talking about health and men's health and everything, I realized I have to be a physical role model, not just a verbal role model. So went on this fitness journey, lost 30 pounds, gained a little bit of it back, but overall really made my health a priority, not just my mental health, not just my physical, but mental health. And so I started running races. And exactly a year ago, this day or this week, I ran my first marathon. So I tried for 3 years, failed, and I ran my first marathon at Disney. But not only did I run the marathon, I ran something called the Dopey Challenge, where you run 4 races, 5, 10, half, and full over 4 days. It's crazy. I wouldn't recommend it, but I did it because sometimes I like to do crazy things. But also, I want to introduce you to, this is a kind of a old picture, but that's my parents right there. My dad, who used to be a dentist, and my mom, who used to have a PhD in homemaking. She really ran our whole family. So, and then these are my kids. I have 3 daughters. This is when they were kind of young. Now they're 7, 7, and 8, and don't really let me talk at home. It's just, you know, that they're my bosses at home. So, but that is a tour of my office here, guys, and a tour of everyone else here. And I really wanted you to show you, and when Michelle and her team reached out to me, I really wanted to kind of give you guys the tour and show you guys the office, because you know, again, this is really a team thing and it's not just a me thing. What do you see taking place in the urology field in the future? I think that's a great question. So the cool thing about urology is that we're always going to be on the forefront of all the other specialties. And I say that with 100% confidence is because if you look at all the things that are out there, hold on one second, let me put this back in here. I can get my advanced audio. How do you do this? There we go. So the cool thing about urology is that we're always on the forefront of technology. If you go in our ORs, if you go and look at our conferences, there's always cool things because we love adapting new technologies. And I just see us kind of not following the trends, but setting the trends when it comes to medical therapy, surgical therapies, and the integration of technologies. I mean, you know, the Da Vinci robot was actually first utilized by other specialties, but just didn't take off. It didn't take off until urologists embraced it and started using it to remove prostates. If you look at all the cool things we do with lasers and little instruments to take care of things inside the urinary organs, it just keeps advancing and advancing and advancing. It's just really cool. So I think urology is going to continue to grow in the future, and I think it's going to definitely be a specialty that's in high demand, and that's because there's just not enough of us. There's only like, I think now 250 urologists that come out a year, and there's a need for like 600 to come out a year. So it's definitely going to be something that's high and in demand. within it. But you guys mentioned all these different things that we're interested in beyond the physician aspect of it. And you can see, like, if you like urology, you can still play a role in it with an MPH or an RN or an NP or a PA, or being a business administrator. You would pretty much be running my office. So there's a lot of really cool ways to get involved within urology. Hi, I watch Netflix while I study. Lol, that's awesome. I don't know if you guys. I love Netflix, and I think the coolest show on Netflix is Designated Survivor. If you guys haven't watched it, I would definitely watch it. But there's a lot of cool things on Netflix to watch. A lot of ways for me to waste my time. And that segues me into one of the questions: is how many hours do I work in a day? I would say, most urologists probably work 50, 60 hours a week. I would say I probably work 70, 80 plus hours a week. And that's because beyond just the operating room and the clinic, I have many different hats. One of the hats is I'm president of our Urology Association here in Florida. So there's a lot of administrative stuff with that. I'm also an assistant professor at our local medical school here. So I get involved in some items in there. I also have a wife, kids, family. And I also I'm a part of some administrative things in the hospital and in some leadership roles within the hospital. So that does consume a lot of my time. And for me, though, I don't like sitting still. I don't like doing the same thing. So it kind of feeds my my need for a dynamic lifestyle. So I don't really sleep much, probably 5, 6 hours a day, but that's just my norm. So you guys should be sleeping 7.5, 8 hours. At least that's what we're supposed to be telling you. But my norm is 5 to 6 hours because, the second I go to sleep, I want to wake up and start enjoying what I do again and start doing what I'm doing every single day. And I think that's what you guys should definitely, when you're going into whatever you're going into. I know I focus on the beginning, just the doctor aspect of it, but you can take those tangents and think about anything. Is you want to be doing something that you just love every single day, that you want to wake up to. And it comes with just honestly not focusing on the money, not focusing on the notoriety that comes with it, just focusing, again, taking it back to the heart. And once you do that, then you're going to love it. Because I do. I love what I do on a daily basis. How do you stay on top of all the new research and tech in urology, and where did you go for med school? So you must be joining us a little bit later on, but I went to Boston University School of Medicine. How do I stay on top of the research? We actually were a part of a lot of research studies. So we actually used to do our own research, but then I realized I don't really like research. I much rather read about it than actually do it. So I am subscribed to some newsletters that come through in email every single day, but also we have our monthly journal that comes out, which I try to read and skim through. And also I go to conferences. So being president of our Florida Urology organization, I have the opportunity to go to all these conferences and constantly be learning new things. So I do get up to speed on a lot of technologies. The cool thing is technology is great, but doesn't mean I have to employ it. I can make my own decisions as long as I'm keeping the patient safe and pertain to certain guidelines. I'm okay. Do I ever watch Grey's Anatomy? Grey's Anatomy, I think I've seen like a couple episodes. I wasn't really a big fan of the show. I don't remember when it came out. I know McDreamy is someone that people loved, and I always hoped I would look like him and have all the ladies love me like him when the show was going on. Maybe it was a jealousy thing. I just didn't watch it. Guys, I'm trying to be fun here, so don't take it seriously. But no, I just never got into it. I think the coolest show out there that's most realistic to what I see in the hospital, in the office, is Scrubs. And some of you may be too young to know about that show, but that show was really true to life, like the janitor guy. And then you have all these different personalities, like in the lab and the attendings. And it really, it did really bring out the comedy of what we do on every single day. Because what we do is pretty serious every single day. We're dealing with human life, but it did bring out like a very lighter side of it, which was awesome. So I noticed your Malakanti and had a kind of stupid, oh, I won't say it, I know in surgery or not. I want to be a PA in surgery and was wondering if I'd have to take off. No. So that's actually a great question, is about accessories and jewelry. And some of us wear jewelry because we like it, and some of us may wear it for spiritual religious reasons. So what she's mentioning is this is called a kanti. And I wear it because I am a Hindu, and within Hinduism, I'm a Swaminarayan, and this is something that we do. We wear for X, Y, and Z reasons that is not relevant to what we're talking about today. But I think it's a great question, is do we have to take certain things off? The only thing as a surgeon, I have to keep my hands clean. Everything else can stay. So when I'm in the operating room, I have a hat on my hair. If I have a super duper crazy beard, then I have to wear covering here. We have eye protection. And then what else do I have on? So I have my hat, my eye protection, and then we have a face mask. And so all of those things kind of come together to protect, and that's really there to protect me, not just me, but to protect the patient as well. And then as a surgeon, I can't have any jewelry. So this, people ask like, oh, how come you didn't wear a wedding band? Because I lost it 3 times. Once I lost it in the trash of the hospital. So I just can't remember it. I've actually lost my Apple Watch like 3 times because I can't have this stuff on when I'm in the operating room. So it just, but those are the only things. And what's really cool is like, if you have certain things spiritually that you adhere to, I would say the healthcare community is very open, very forgiving, not forgiving, very accommodating. So there's certain religious backgrounds that don't work on Fridays, or certain religious backgrounds that can't touch certain things, etc. I think, people are very, open to accommodating. But to be honest with you, at the same time, like at the end of the day, it comes down to patient care. So if a patient's crashing, for me, everything goes out the door, and I just do whatever I need to take care of the patient. These have been some great questions, team. So I know our time is short here, but what I did want to tell you guys is, regardless of what specialty you go into, I think there's something that's very important that you guys should be doing, is kind of enhancing your online social profile. And that doesn't mean like, you post like, really cool pictures of you looking good, reading a book, or, in your white coat, or, at the library. I think those are really your online profile. And that's your professional profile. And I don't think, I guess you could do it on TikTok. I'm on TikTok, but it's just for fun purposes. Instagram is just more family. Facebook is dead. But LinkedIn is what I recommend that each one of you get into right now, because LinkedIn truly is a professional network. And, when people type your name, that is something that comes up. And I think it's time to build on it if you haven't. A lot of young kids, youths, don't think about LinkedIn when they're thinking about their online profile or social media. But if you start building that repertoire on there now, you'd be surprised how many cool people you meet on there that could potentially help you in the future when it comes to observerships that you may need, when it comes to mentoring that you may need. You're no longer restricted to your bubble where you live. When you have this awesome professional network, it's just wild how you can use it to your advantage when the time is right. So imagine like your school helping you get hours for community service, and you just have this one little thing that you can do locally. Imagine reaching out to someone that's there and prominent, that does this, and you see them on TV and they're so well respected, having engaged them on LinkedIn and being able to be part of a project like that. Like, only reason I say is because I've been able to do really cool things because of the people I've met on LinkedIn. I think you guys should definitely focus on it if you haven't. So I don't know what I do here. So was there any other questions here? So I was gonna just put in the chat just my profiles, but you know, I would really say like I would love to just have you guys follow me on LinkedIn and continue the relationship. And if you haven't, then maybe this is a way for you guys to build your LinkedIn you know, portfolio, because I do think it's very important to have that online presence in a professional, obviously in a professional manner. But I think LinkedIn is really the go-to and the best place to do that. So obviously this is all things, but LinkedIn is definitely my favorite if you haven't started something. Having an experience when you did not know how to treat a patient. Absolutely. Even today, been doing this now 7 years since I finished school, and I still get into situations where I'm overwhelmed and I just don't know what to do. I'll give you a really, well, let me tell you this. So in most cases, when I get into those situations, I call up some of my colleagues. So either it's people that I train with, or it's people that I've met since I've been done, and I just ask for help. Early on in my career, I was very nervous to ask for help because I thought people would judge me and think I don't know what I'm doing, etc. But what I realized is people now actually respect me more because I know when to ask for help. And that's why training takes so long. It doesn't matter whether you become an RNPA, NP, MD, DO, or MPH or PhD. It takes that long because you have to kind of go through all those experiences to know what's wrong or right when you are there on your own. But there's definitely been times where I haven't known and I've called some people up, but there's also been times where I've had, I would say, just some intervention, like some divine intervention that's gotten me through certain things that I'm struggling with. And I'll tell you, I'll share an experience with you. Is I was, you know, when COVID happened, obviously we shut down except for emergencies. I avoided a lot of these emergencies by just managing them, you know, medically. But there was a patient that came in with a stone that was blocking him. He had a super duper bad infection. And he was something called septic, which means he's having blood pressure issues and etc. So, you know, he needed intervention. I needed to do something right then and there, which is put a tube into his ureter to bypass the stone so that the kidney can drain better. And once the kidney starts draining, the infection can be cleared. The patients generally get better. But this patient was COVID, you know, was suspected to have COVID. So this is early on where testing wasn't as strong. Like, you know, when, you know, the test may take X, Y, and Z time, you don't have time to wait around when you have a sick patient like that. So I was actually one of the first to have a patient like that here. Now it's commonplace, but back then it wasn't. And I couldn't find that. I got into the bladder. I couldn't find where to put the tube because everything was just so swollen. I'm like, why would this one patient do sick like crazy and everyone in the room is so stressed out? You know what? I tried. Then, you know, it was almost 25 minutes in, I closed my eyes, took a pause, said a little prayer, and just said, please, someone help me here. And then I don't know how, but like within just a few minutes, like we were able to get in, put the stent in, etc. But at that moment in time, all I really did was calm my mind down. It wasn't like who I was talking to or what I was feeling. This is not really a spiritual thing. It's just calming down. Because the second that my team sees me stress out, they're all going to stress out even more. And then now I'm compromising patient care. So I had to kind of just calm down, get my strength back, and then just make it happen. And luckily we did for that patient one day. So it's pretty awesome. And I'm sure you guys are thinking, has a patient died in my hands? Yes. Not because of something I did wrong, but because they were just a very sick patient. And this was just a year or two ago where we had a patient that was very sick, needed a procedure. So obviously the benefit of the procedure outweighed the risks. But this patient in the operating room started having major changes in their blood pressure, something called VTAC. I don't remember a lot of these things in cardiology, but I know VTAC is bad. And when your whole team is like, whoa, we need to stop right now, you know, that's something bad. So, you know, unfortunately in that case, we had to stop doing what we were doing, and the patients had to have almost instantly be resuscitated. And we started doing chest compressions, and you know, it was a sad ending. But that's medicine. You have all these great things, positive things, but you also have to be ready for the bad things. And it's not really, I guess it is a bad thing, but you know, it takes some time to get past these things when they do happen to you. But then you realize that's medicine. You're gonna have the goods and the bads, and you got to be able to just keep moving forward. Or as that thing says, never give up. So I think, Michelle, I think it's good, right? Are we good?
Yeah, that was
Was I
amazing.
boring? I'm sorry, guys, if I was
No, no.
boring. I wasn't trying
It
to be
was
boring here.
amazing. I love your office, just by the way. My favorite color is blue,
Wait,
and I
hold on,
love
I
your
can't hear you.
lights.
Hold on.
Your open mindset towards medicine and your enthusiasm was just so inspiring, and you're so positive, and you really love your job. So I loved your everything. So thank you so much for coming. Yeah.
Thank you for having me. Happy Friday. And if you guys haven't taken up any New Year's resolutions, I would say don't take any resolutions. It's not worth your time to focus on lists. Stop worrying about the list and just keep doing. And don't let anyone tell you can't do it, because I had a lot of people tell me I can't do it, and I made it. You know, I can brag about it now. But whatever you do, as you saw with Earl, like he changed his mind at the age of 40 plus. If you haven't figured out what you want to do, it's not a big deal. Just keep moving forward, keep doing you, and just enjoy every single moment, because life at the end of the day is very precious. So thank you, team. And I hope you guys have a great weekend. And we'll see you on social. Thank you, guys.